Kristen. Well, today's inversion is hard on all of us, especially those who have respiratory illnesses or lung disease. And sure, we can stay indoors, but is that really better?
Pulmonologist Dr. Denise Blagev at Intermountain Medical Center here to talk to us about air filters and whether or not they actually work.
So usually the indoor air quality is better than outdoor air quality, but it really depends on the individual home.
Yeah.
One of the best things to do is to make sure your own furnace filter is clean and you've changed it the way you should. And beyond that, you can use kind of those portable air filters. They do trap particles. What we don't know is whether that traps enough particles to make a difference for people that have symptoms.
Yeah, and you're interested in doing something about that, right? You want us to look into that?
That's right. So we're doing a study looking at people, and actually we've expanded to people with asthma or at risk for COPD, former smokers who have worsening symptoms during inversions, and we're putting in a standalone unit in the home trying to answer that question. Do they feel better during those inversion periods when the filters are running versus not?
So at this point, because we're not really sure whether or not it makes a difference, is it really worth the investment?
That depends. You know, I have a lot of patients in clinic who have COPD or asthma, and they've put them in and they feel like they can tell a difference. Okay. And then people that don't have symptoms and don't have a lot of sort of interest in doing it tend not to do it. So it is a little bit of an investment. It's a standalone unit. They're commercially available. But people with asthma, you know, some of them say it makes a big difference for them.
I want to take a couple steps back, because one of the things that people should do before trying to clean the air, right, is to actually not make the air more dirty. Right. Some things that they should avoid.
So the number one thing is no smoking indoors. And even if people are smoking outside and they come back in, there's sort of some of the smoke coming in with them. Other things would be wood-burning fireplaces can really create a lot of particulates in the air. Things like burning candles or incense are generally not a great idea. Again, those create particulates in the air.
And a couple of terms that people might not be familiar with: HEPA and MERV.
Right.
What are those things? What do they mean? Why do we need to know them?
So the HEPA filter is just a way of rating the filters that trap particulates. And then MERV is, again, a rating on the commercial filters that go from usually 1 to 20, but commercially you're going to look anywhere from like 9 to 16 or so. So the high MERV filters are those 13 to 16 that really trap those tiny particles. And one of the tricky things with air pollution is that, you know, when we look out there, it might not look that bad, and yet you look at the readings and it is bad, and you're not necessarily seeing kind of the tiny particles that are the ones that are really doing the harm. Other times you might look and it looks terrible, but the air particulate counts aren't so bad, and that might be because a lot of what you're seeing is vapor and fog mixed in with the air pollution. So really the best way to know what the particulates are is to look at the ratings.
So it can be deceiving. You need to trust the experts on whether or not it's safe for you.
And keep that furnace circulating, even if the heat's not on, right?
That's right. Yeah. And most of them will have the newer ones will have a fan running to sort of filter the air, but that's exactly right.
Oh, great.
Thank you so much for coming in and talking to us about that.
Always good to have you. Thanks, Dr. Blagev.
Thank you.